This is the 111 News from ICU Management and Practice. A new study reports that people with COVID-19 are more likely to develop depression, dementia, psychosis and stroke. Those admitted to hospital or in intensive care are at even higher risk. Coronavirus has a direct impact on the brain. Findings are based on an analysis of the electronic medical records of more than 500,000 patients in the US. The more severely ill with COVID-19 the patient had been, the more likely they were to receive a subsequent mental health or brain disorder diagnosis. A growing body of research indicates that genetics should be used to determine what we eat. With increasing realization that obesity is associated with severe COVID-19, the future should see a greater emphasis on personalized nutrition with use of data from genetic tests. This approach, referred to as Nutrigenomics, is a comprehensive strategy that includes not just diet, but sleep patterns and the overall lifestyle of an individual. It's finally official. Top disease officials from China have finally admitted that the Chinese vaccine's effectiveness is low, and the government is considering mixing different vaccines from different technical lines for the immunization process. Beijing has already distributed hundreds of millions of doses abroad and has also tried to create doubt about the effectiveness of the Pfizer-BioNTech vaccine. No foreign vaccines have been approved for use in China. At current global vaccination rates, it should take around 4.6 years to achieve worldwide herd immunity against COVID-19. This gap is likely to allow variants of the virus to develop and spread and could potentially render the current vaccines ineffective. 159 countries have begun their COVID-19 rollout, but vaccines still remain scarce in low-resource nations. This global vaccine inequity will make it difficult to end the pandemic. The Centers for Disease Control and Prevention has declared racism a serious public threat. According to CDC Director Rochelle Walensky, racism affects the health of the entire nation. One of the most visible examples is found in the pandemic. Racism has affected people of color, and people from ethnic and racial minority groups are at a greater risk of getting COVID-19 and of dying from it. Even healthcare workers of colour are more likely to care for patients with suspected or confirmed COVID-19, more likely to have inadequate protective gear, and twice as likely as white colleagues to test positive for the virus.